Morning again. This is Dr. Anthony Chang coming to you from Southern California, and very excited to have a special guest from Northern California, Matt Lungren, who, as some or most of you know, has been doing really some great work in the area of radiology and using artificial intelligence, and I'm a great admirer of his work, and as well as the center that they formed. So, Matt, welcome. Tell
Thank
us
you.
about it's inevitable that we'll end up talking about COVID-19 at some point, but tell us about a little bit more about the work you're doing in the center, and then as it relates to COVID-19 and the exciting work that's there now.
Absolutely. Yeah, thank you. And it's really great to be here. Appreciate it. Yeah, so at Stanford, we're just like a lot of other places, we've kind of put together an infrastructure so that, clinicians and computer scientists can work together to try to solve, important problems in medicine. A lot of the initial work that we began was related to radiology, as you can imagine, a lot of imaging related deep learning science, but it's really broadly expanded now. We have over 120 faculty at the center. It's the AI/MI Center at Stanford, and that encompasses 9 departments. So you have folks from medicine and pathology, cardiothoracic surgery, and everything else. But you also have computer science, electrical engineering, and biomedical informatics. And it's really been really exciting just to have an opportunity to sort of see these multidisciplinary teams come up with some ideas. They learn from each other. I've seen more doctors learning to code, and I've seen more, deep learning researchers who are talking to me about opacities on chest X-rays. So it's a fantastic cross-pollination, and it's really exploded, at least at Stanford. And I think it's given us an opportunity to learn a lot about what's possible, and then to expand our efforts into maybe deployment in other parts of the world.
Yeah, tell us how you've responded to COVID-19, and I know you're a pediatric radiologist, and we were fortunate that this time COVID-19 isn't affecting a lot of children, but I think in the future we will have such a pandemic ourselves. So, but how do you working on COVID-19 and its issues with radiology?
Yeah, no, I guess it's one of those diseases that I think surprised us in the pediatric community for sure. I think we were expecting to see, the usual, what we call the U-shaped curve, right? The impact on children and the impact on elderly, members of the community. And we found that, it was definitely passing over healthy children. It's still unclear whether there's transmission, obviously, in a low level.
Right.
But what we did see is that we treat a lot of immune compromised and organ transplants, and these kids actually are doing fairly well also. So it's really been a literally passing over of a lot of the patients that we would expect to be vulnerable in our population. But at the same time, I think when we took a step back and recognized that in the Bay Area, we're one of the epicenters of this disease, certainly early on. And our colleagues in Washington, we had regular conversations with them to understand, what are we going to be getting into, conversations with our colleagues in Asia and of course in Europe. And I think that we did a tremendous job preparing on the hospital side, but it also allowed us to mobilize our data scientists. Yeah. And a lot of our community efforts. And so what was really fascinating, I think, about the response here in the Bay Area is you kind of had this two-pronged reaction. I think the first was that there was an early realization that this is potentially a big impact to our broader community, and our colleagues in tech really did spend a lot of effort making sure that their team members could work from home very early on in this. And instantly, even as someone who lives in the area, I saw that there was just a decrease in overall, traffic and general congestion. But at the same time, the second prong of that approach, which was really exciting, I think, from us, from our group on the data science side, was that we engaged the county, we engaged the leadership of the different tech companies, but also the healthcare groups, all the hospitals working together. And we share data freely. And I think it was probably something that we've been talking about for years. And we always say, hey, we should share our data, and it never really materializes.
It took a pandemic. It took a pandemic to.
I hate to say that was a catalyst, but it was. And I will say, if there's a silver lining or something to take away from this, I think it's the combination again of everyone pulling together, social isolation. People just said, we're going to do it and we're going to be determined to do it. But then also this huge data science sharing effort where we've been able to come up with risk calculators. We have a 4 or 5 stage plan here. We've been communicating with the county and the public health departments. And then also we're able to now model out, not only just what's going to happen to a given patient based on clinical and imaging data, but then also can we automate some of this so that we can translate our knowledge and scale it?
Yeah, no, everything, I think there's going to be a lot of lessons learned in not just AI, but also telehealth. And it's been accelerated exponentially in the last few weeks. So tell us, were there any differences in findings between children and adults in the few children that you've seen?
Yeah, there were. I think that one of the things that we are still looking into, and I think a lot of groups are, we've seen some reports out of, the early Chinese data. We've seen some, release of some of the early data from the CDC. We are still trying to understand the true prevalence amongst kids. I think there's this, suspicion that there is an asymptomatic spread. I think we have some rapid serologic tests we're going to be able to do. But what we're finding that the imaging findings are not as pronounced as we've seen, even in some of the asymptomatic adults that incidentally are found to have these COVID findings on CT, for example, for other reasons. We aren't seeing that same pattern, at least as often as we are in the adults. But at the same time, I think we are looking into other areas of transmission, and so there has been a lot of conversation around, is this something that can be spread through the GI tract? And I think that's an active area of investigation by our clinicians here. And so certainly I think that there's some, again, like many other viruses, they have multiple modes of spread.
Yeah.
And,
the heart too, right? You're finding some cardiology finding.
Absolutely. I have seen, again, I putting aside the pandemic, the cost of the pandemic, the huge price that we're all paying, I think that we're also learning a ton about both ourselves as a medical community, our public health department, but also about maybe we don't know as much about viruses as we thought we did. I think we just kind of said it's either a cold or the flu, and then just proceeded accordingly. And I think we're, again, I'm humbled by this almost every day.
As I mentioned in previous webinars, I think viruses collectively are actually quite clever with a very, very challenging enemy. So with that, I just want to, again, thank you for your time today. Dr. Lungren is going to be a featured faculty at our upcoming virtual conference on artificial intelligence and radiology. So we look forward to hearing a lot more from you during that virtual conference, and maybe we'll have a chance to elaborate on everything we talked about in a lot more detail. So that virtual conference will be May 20th, and you'll be getting more information as well. So thank you, Matt, for your time, and I look forward to working more with you.
Appreciate it. Great to have you. Thanks.